I think most people have joined us now. So, Nazmi, do you want to make a start?
Okay, yes, we can start. Hello, everyone. Can you just share the? Can I share the screen, please? Okay.
Yeah, I've made you a co-host.
Okay. Great. Yes. Okay. Okay. Shall we start now?
Yes, please.
Okay. Okay. Hello and good afternoon, good evening, according to the time where you are locating, everybody. Today's session, we would like to discuss as part of the virtual workshop on innovative methods for researching disability and COVID-19. We are going to discuss researching disability in pandemic and also in other crises, focusing on Palestine, Lebanon, and Jordan. And we have three presentations on three countries. And I would like to start with allowing my colleagues from Birzeit University and Lebanon to introduce themselves and to also give the title of their presentations. So, Suzanne and Lina, please.
Yeah. Hello, everybody. Can you hear us?
Yes.
Yeah.
Can hear you.
My name is Suzanne Mitwalli. I am academic researcher at the Institute of Community and Public Health, Birzeit University. And my colleague Lina Abdel Samad, a research assistant at Birzeit University at the Institute of Public Health and Community Health.
Okay, thank you. Now, Itab.
Hi, everybody. I am Itab Shuaib, Dr. Itab Shuaib. I'm an inclusive design specialist, specialized in the concept of inclusive design from the architecture perspective, how to make the environment and the built environment accessible for all, including people with disabilities. And also my focus is on enhancing the educational tools and methods to be inclusive as well for people with disabilities. Today, I will be talking about the research disability in conflict and the pandemic, and we'll cover Lebanon and Jordan case studies. Thank you.
Thank you, Chab. Thank you, Lina. Thank you, Suzanne. And we'd like to thank also Rita, who couldn't join us from Birzeit University. Today, myself is Nazmi Al Masri. I work at the Islamic University of Gaza in the Faculty of Education. I've been working on several projects on disability issues. And I will start the three presentations we will give. I will start with the first presentation, as you can see, on researching disabilities in Gaza with the different crises concurrently happening: occupation, siege, war, and pandemic. I will talk about the 3 points briefly and quickly. The first one is just briefly mentioning and emphasizing the multiple crises that Gaza has been going through over the last years. And then I will talk about the impact of these crises on researching disability, focusing mainly on the impact on researchers and participants with persons with disabilities. And then I will talk about, last point is about innovative methods for researching in such context of multiple and protracted crises. For in fact, the crisis happened concurrently over the last years. Occupation, which has been going on for the last 50 years. And okay, just a second. Okay, sorry, controlling about 2 or more than 2.3 million Palestinians under military occupation and policies that restrict the movement, resources, whatever. Then we come under siege for the last 16 years, sea and air siege, making Gaza the world's largest prison, open prison on earth, and also preventing mobility. Then comes the war, one of the 4 wars over the last 12 years, which happened last May 2021, which caused more disabilities, more unemployment, more poverty, and more mental health problems. And overall comes pandemic in a small area, tiny area, one of the most populated areas in the whole world, and with high rate of unemployability, poverty, and 70% of the population in Gaza are registered refugees. This crisis, in fact, created several problems, socio-economic problems, health problems, and many other types of problems and challenges. I will focus on one only briefly, which is mental health problem, negative feelings and emotions, which cause distractions, lack of focus, lack of concentration among the researchers and academics, among also persons with disabilities, among the students with disabilities, and the whole context has been lacking of focus and lacking of peace of mind and inner peace during being always busy, flying ideas on coming ideas, thoughts from different things, worries, stress, fears, especially among persons with disability. Couldn't in the interviews, it was very clear to see how they were scared. They are coming out of war, coming out of crisis, COVID-19. Though the interviews and focus groups, in fact, took place face to face after we took all the precautions and health safety measures, as I in a minute. Why worries among the participants more than others? Because war to them and COVID-19 are a threat to their health and to their life. And most of the persons with disability in Gaza have been suffering from war as a result, and this results in disability or more disability. So all sorts of negative feelings and emotion, as you can see, distress, sadness, loneliness, demotivation, annoyance, helplessness, frustration, all can affect how we can conduct research. What we did to overcome this, several procedures. One of them is early planning. And also part of early planning is engaging participants in selecting the date, days, time, facilities, so they can choose, so they are engaged according to their convenience. We welcomed them at the entrance of the university and the entrance of the building, and welcoming them just to release the tension and worries and fears they have been going through. Also, we have been very, as a team of researchers, very positive and active listening to them as long as they want to talk, as long as they want to communicate. We tried our best to let them have sufficient time and to say whatever they want to say and discuss. Also, accessibility, which was a specific building, accessible building, a spacey room, so they can also find it useful. Transportation costs have been covered, even covering not only the participant, but all, if anybody, a companion with them, also they will be covered. And this encouraged them to participate in the focus groups and workshops. We were very flexible in terms of timing and not very strict on that. Confidentiality, personal anonymity, safeguarding, privacy, all measures taken for that, as well as safety procedures. Third or second procedure we took was using more than data collection tool to ensure reliability and validity of the data we collected, but we depended on desk research and reviewing documents, plus focus groups and interviews. Also, what encouraged us is the adhering to values and commitment to values of resistance and resilience, combined with determination and optimism as a researcher and academics, we cannot submit and surrender to the very tough reality. Otherwise, no gains will be achieved, no teaching, no education, no research. Last technique, and which is the most important technique that I have been using over years, during the different wars, is writing and co-writing pieces of writing and publishing them with colleagues from UK as part of a project entitled, as you can see, CUSP, or Culture for Sustainable and Inclusive Peace. So I wrote these pieces, 3 of them. Linguistic deficiency talks about, in fact, my feelings and feelings of other academics and researchers, and also how these affect badly research and how we can and should overcome them. Just to quote briefly in half a minute about what I did. I was chatting with my family, and my sons and daughters keep asking me, Dad, if questions, many if questions. Dad, what happens if? What will happen if? What are we going to do if? Taking into consideration the war is on. These are written during the war, the 11-day war. And I start thinking about this. Oh, some people phoned me and asked, how are you, etc. I said, if somebody asks me, I will see the quotation below. I am okay so far, but unsure what might happen in the next minute, or the next hour, or the next evening, or this evening, because most of the airstrikes happen after midnight, killing and causing a lot of problems. Then suddenly, a heavy, loud bombardment killed my train of thoughts when I heard the explosion and airstrike. Then I just looked, I had my mobile, my laptop, TV, what happens? And then the bad news comes that an Israeli airstrike killed a wheelchair father with physical disability, Iyad Salha. It's just a few 100 meters from where I'm living in my town, and killed his pregnant wife, Amani, 33, and their 3-year-old daughter, Nagam, in my town, Deir al-Balah. And they were ready to eat lunch together in their homes when they were killed. This gives a lot of depression, stress, anger, disappointment, lack of focus, etc. Thank you very much on this. I hope I am on time. And now let's move to Lina and the floor is yours, and Susan. تفضلوا. You are muted. Okay, let me stop sharing so you can share.
Hello, everyone. So
Hello.
I'm Lina Abdessamad, and I have my colleague.
Suzanne Mitwalli, as I introduced myself.
So our presentation is titled Researching Disability in Conflict in the Pandemic. Next slide, please. Next slide, please. Yeah, thank you. Thank you. So our presentation basically revolves around the double captivity of the Israeli military violence and the Israeli military occupation and the COVID-19 pandemic. So I'm going to give a quick overview of our context here in the West Bank. So starting off in the West Bank, since 1967, the West Bank has gone through many different forms of Israeli military violence. And this sorts of violence, it comes in many different forms, including the colonization of the land, the illegal establishment of Israeli settlements, and both direct and indirect political violence. So basically, what does this all mean? This means that Israel controls the movement of people, of goods, of resources, and of borders and crossings. So it makes it very difficult for us here on the West Bank to travel from one spot to the next. As we see here on this map, we see the illegal Israeli settlements in blue dotting the landscape. And this is basically just showing us how difficult and how much the illegal settlements are crowding all over the West Bank. This visualization here shows us the fragmentation of Palestine over the years as Israel has been taken over Palestinian land. So as mentioned before, the Israeli occupation makes it very difficult for us here in the West Bank to travel from one spot to the next. Thus, it makes it very difficult for researchers such as ourselves to conduct field research, and we go through lots of different difficulties. Some of the difficulties that we face due to the Israeli occupation include crossing Israeli military checkpoints, roadblocks, the illegal settlements, and barriers to crossing. And this is all very taxing on us, on the daily civilian, as the occupation controls basically all aspects of daily life. And it's very, as I mentioned, it's very taxing because detentions and arrests can take place on the spot. So there's a lot of uncertainty. And there could be many delays when it comes to going from one spot to the next or reaching our destination. And this delay can vary from hours to even days. Thus, to combat this, usually Palestinians use makeshift dirt tracks so that they can cross through roadblocks that are created by the Israeli army. As seen in this photo here, we have a photo of the Institute research team trying to, they're in a field work, but they're stuck as they are trying to pass through the makeshift dirt road that is blocked by the Israeli army. As we can see, the yellow transportation. And here, because the Palestinian society is a very collective society, we have the young men, the shabab, who are jumping in to lend a hand. And my colleague Suzanne will take it from here.
I can't hear any. Okay. Can you hear anything?
I think we've lost Lena and Suzanne. Give them yes, I think Lena and Suzanne have just lost connection. So we'll give them a minute or two, and then if not, we can move on to ETAP's presentation and come back to Lena and Edna.
Okay.
Just keep an eye.
Can you hear us?
Yes, we can hear you.
Starting video. Yeah.
See you now.
Hello, everybody. Can you hear us?
Yes.
Can you hear us?
Yes, we can't hear.
Yes, we can hear you. We can hear you. Yes.
We can hear you. Okay.
Yeah, we can hear you.
Okay, great. Okay. Sorry about this. The program was frozen. The Zoom program. Okay. So I will continue on the presentation. So my colleague Lena gave us an overview of the difficulties of conducting research in war-like conditions. So for us, the pandemic came on top of the chronic political violence, and it meant
that we could no longer conduct research in person as others everywhere in the world. Thus, we moved to conducting research remotely, doing phone interviews and we used mainly mobile phones. This is because the lack of access to the internet by many people here, especially for people with disabilities, who are under the poverty line. Another reason for that is that most people here are not used to using online platforms such as Zoom and Microsoft Teams. Next slide, yeah, thank you. So for us, what was lost with remote fieldwork? We lost many important aspects of researching, such as participant emotional expressions, feelings, body language, which are considered important aspects of qualitative interviews. We also missed these issues, especially with people with hearing disabilities. And our concerns were that the translator was oversimplifying or excluding certain details of the interview. So also we missed the human touch, which comes with being with participants and seeing and hearing them, especially with people with disabilities, that this aspect is very important. Now we are moving to what we gained from doing phone interviews. There are some positive aspects that we gained from doing phone interviews. First of all, we felt that the respondents were more honest and less embarrassed answering our questions with phone interviews, especially that interview questions focus on difficulties that the participants faced in accessing different services during the pandemic. Also, phone interviews saved us time in going and coming to the field and crossing Israeli checkpoints. And also it saved the transportation costs. It saved us money for transportation costs. And most importantly, it saves the stress of uncertainty related to crossing Israeli checkpoints. So uncertainty of whether we will be able to cross or not, will we be in danger or not. And additionally, we avoided the
I think we've lost your sound again, Lena and Susan.
Okay, what do you suggest, Vera? Okay.
Okay. Should we give them a minute again, and if not, we'll move on to ETAB?
Yeah, how many slides are still
I
remaining?
think there's one more slide on lessons learned after this. So
okay, she was talking about what was gained. And just if you go through the 2 slides remaining or 3 slides, and then we go to ETAB, and they can come back, they can give a brief summary of what they wanted to say. So let's make use of our time. Shall we move to ETAB?
yes, sir.
Okay, Tab, you need to change the slides, please, Vera.
Yep.
So
Yes, we can see them now.
you can see my slide.
Yes, we can. Yeah.
All of it. Okay. So I think the situation in Lebanon is it's a bit different from in Lebanon and Jordan. The field work was a bit different from the Palestinian case studies. So I will be talking first, introduce the viewers, the attendees, about the background of the two countries. I will also talk about the location, when we did the research, the logistic issues, the reaching out to participants, lack of resources, and positive side of virtual interviews. So Lebanon and Jordan, they are both located in the Middle East. They both have borders with Palestine. Beirut is the capital of Lebanon. Its population is 4.3 million. The area is 10,452 kilometers square. The languages is Arabic, English, and French. And the religion is Islam and Christianity. And the country was founded in 1943. Jordan, the capital is Amman. Its population is 10.2 million. The area is 89.342 kilometers square. The languages is Arabic and English, and the religion is Islam and Christianity. And the country was established in 1946. So when we wanted to conduct the study in Lebanon and Jordan, both countries have issues and a crisis. If we talk about Lebanon, since the late 2019, Lebanon is experiencing overlapping crisis, which is we have the worst economic crisis in decades. We have social unrest that started in 2019, and we have political instability. So this has intensified the situation, and then added to it, we had the COVID-19 pandemic, which reached the country in February 2020, and then that added restrictions on how to conduct studies, and all of the institutions were closed and so forth. Then added to it, we have the 4th August Beirut port explosion, which has aggravated the people's vulnerabilities. Many people had disabilities because of the blast, and also it affected the economic crisis. Many of the schools were demolished. Many of the students were again at risk. They couldn't attend schools and so forth with the, because of the schools were demolished. In Jordan as well, because of its location, it's also affected by the countries around it. So with the issues in Syria, with the issues in Iraq, Jordan at the moment is hosting many refugees. It's expected to be around 750,000 refugees. 90% of them are Syrians, and we have Palestinian refugees as well. So when we conducted the study, it's under the Disability Hub Center for Lebanese Studies at the Lebanese American University. So that means that the researchers are all based in Lebanon. With the COVID-19 restrictions, we couldn't travel to Jordan, so we had to try to find another methodology to collect the data. So we had to hire a research assistant in Jordan and arrange with the researcher virtually, so the researcher can, or the assistant, she can recruit participant, and she can take notes virtually, because the interviews was mostly conducted in Arabic. While in Lebanon, half of the population preferred English, others preferred Arabic, so we were shifting between the two languages. It was difficult to interview people from the ministry, stakeholders from the Ministry of Education and Healthcare in the two countries because of the bureaucracies and the limited research time. The logistical issues, the first thing was obtaining the Institutional Research Board, the IRB, which was a very lengthy period. It took more than 4 months to obtain the IRB approval from the Lebanese American University. That meant that those time were, while most of the students were still at school, it was and by the time we wanted to start the study, once we got the approval, it was difficult, to interview most of the students, because especially if they are under 18, above 18, because they were busy conducting having their exams. So during that time, while we were waiting for the IRB, we took the advantage of the time, and we did the research review. We reviewed reports, studies, and we prepared a list of potential participants who might fit within the scope of the research. And once we got the IRB approval, we managed to conduct the study within like 6 weeks at both countries at the same time. So we were interviewing participants from Lebanon and Jordan virtually, and we managed to interview 18 participants in each country, and they were parents of children with disabilities under the age of 18, people with disabilities above 18, and stakeholders from the local disability organizations, stakeholders from the educational and healthcare services. How we managed to reach out to participants, we relied on multiple outlets. We relied on emails, we relied on phone calls, we also relied on snowballing sampling. So we used to contact the school principals, check with them if they have students who have disabilities or parents who are interested to take part in this kind of study. We also have disability organizations that we contacted. UNRWA, for instance, we also included refugees in both countries. So we wanted to make it as diverse as possible. The lack of resources, we had issues with, especially in Lebanon, we have the electrical power cuts and the slow internet connection in Lebanon, which affected us to collect the data in both countries. So this affected us to, to target to have interviews with 2 potential participants, for instance, from the healthcare services and the education in Jordan, wouldn't be able to, and they couldn't attend the interviews because of their time didn't match with our time and with the electrical power cut and so forth. To compensate what we had to do, especially in Jordan, that many of we wanted to target refugees as well. We wanted to target people not only in Amman, but different places in Jordan. So we had to offer them internet bundles so they can take part in virtual interviews. In Lebanon, due to the electrical cuts, we were, some of the time we were interviewing them on Zoom, and then when there is an electrical cut, then we used to contact them via phone, complete the interview, and sometimes we relied on WhatsApp calls. They used to record for us their voice calls and notes. They used to send text as well via WhatsApp to complete the answers. Also, some of the participants relied on mobile applications, especially with the consent forms. So because there was a lack of paper, lack of printouts, because there's no electricity, so they couldn't print and sign the consent form. So in that sense, we offered them different options. So they relied on mobile applications to sign it automatically. Some of them used as well to send it via WhatsApp. Others, once we're having the Zoom interview, they used to orally. We used to recite and orally the consent form, and then they told us to tick the consent, and they gave us their consent form in that sense. Finally, the positive side of using virtual interviews, and that happened in Jordan. So we had a Jordanian sign language interpreter who was paid to do the service and who managed to do virtual and moderate the virtual interview with 5 people who are from the deaf community using the Zoom. So we had the Zoom call, and we used to interpret. They used to lip read what the researcher was asking, and that was a very interesting data collection methods where there was a lot of interaction with the translator and the researcher and so forth. So that was to use the accessibility component of the Zoom to carry on the data collection methods. Also with the Zoom platform in Lebanon, because it was very convenient for people with disabilities who couldn't, who couldn't leave to go to a place to conduct the interviews because they wanted to secure somebody who can give care for their children. So while being on Zoom, that meant that they can conduct the interview without worrying about paying extra amount of money for their caregivers and so forth. And also the accessibility component, because of the, sometimes most of the places were inaccessible, so that was an added value. So that's all. Thank you so much.
Thank you. Thank you, Aitab. We still have a few minutes for questions or comments or feedback. Okay, I will be happy to answer any question or listen to any comments, feedback. Any question, any comments? Okay. If not, then Vera, do you have anything to say?
Not at the moment, and maybe if
Okay.
we could move on to the 5-minute, 10-minute break, and then we can save questions until
Okay,
after
then
Ursula's
thank you
presented.
all for coming along.
Thank you. We'll just take a 10-minute break. We'll be back at 10 to 4 UK time.
Okay. Okay, have a nice break, everyone.
Thank you.
Ursula, are you back?
I'm here. Yes.
Would you like to make a start?
Yes, I will. Yes.
Thank
Just
you.
give me 1 minute. I'll share my screen. Okay. Yeah. Okay. Not at the end, not the beginning. Okay. So, okay, stop my video. Okay, can everybody see that? So thanks for having me at short notice. It's nice to see some old colleagues online, Suzanne particularly. Yeah, I just agreed to step in, so forgive me if this is a bit short, prepared at the last minute, but things that we've been discussing for a while. This was our research project in Ghana and Indonesia, which looked at the impact of COVID on people with psychosocial disabilities in Ghana and Indonesia. And it's quite interesting to compare these two countries in this respect, because it was the course of the pandemic was very different in both these two locations. Our study was aiming to think about the impact of the pandemic and government responses on the health, relationships and daily lives of people with psychosocial disabilities and access to health care and social protection schemes, and the consequences of the pandemic and government responses to the human rights of people with psychosocial disabilities, including use of coercion, restraint and detention, because these are particular concerns in Ghana and Indonesia, and Dora, the research, has been exploring some of these issues. We also wanted to look at the resources, supports and strategies that people use to prevent social isolation and human rights abuses, to adapt to the pandemic restrictions and the social and economic impacts, and to support their recovery. And then how best to include people with lived experience of psychosocial disabilities as active participants. So we trained peer researchers. If anyone was in the previous session, you'll have seen that we trained peer researchers in both countries to work with us on the data collection and analysis, and also now they're also working with us on some outputs, and we are using this evidence to develop some guidelines around inclusive recovery, as we've been doing across the network. So we conducted research probably a bit over optimistically in two locations in the two countries over a very short time scale. In Ghana, we were in two cities, one in the north, one in on the coast, and in Indonesia, in the capital Jakarta and in Jogja. And it's interesting to compare, because I just pulled up this data and you can see Ghana is the red line and Indonesia is the blue, I don't know, darker line anyway. I mean, I haven't had a chance to unpick this data, but I mean, you can see that clearly the impact of COVID has been massive in Indonesia compared to Ghana, which really, it hasn't had too much of an impact in terms of disease burden and infection rates and restrictions. Indonesia, on the other hand, has had like a very high burden of COVID deaths, you can see, and they had this massive peak in July last year where a lot of people were dying, health services were overwhelmed. But in Ghana, that hasn't happened. Thankfully, the very fragile health system was not inundated with cases. Of course, that doesn't mean that there weren't a lot of infections. I mean, we can say testing was, very minimal in Ghana. So there may have been a lot of undetected cases, which we just didn't know about, because Indonesia is a better resourced country than Ghana, though it's still counted as a middle income country. So the impact of this is interesting in that whilst Indonesia had a very high burden of COVID and a very high impact in terms of infections and mortality, Ghana did not. So well, what did that mean for the participants on the ground and for our research team? So there were fewer restrictions. I mean, Ghana had a very, very brief lockdown and mask wearing and things like that, hand sanitizers. Ghana has a very good public health messaging kind of, there was a lot of that. I mean, we were in Ghana in November and we were able to see, you know, a lot of public health messaging around, and that those messages had reached the community. So everyone knew about corona, hand washing, hand sun, need to be wearing masks and things like that. But there was also a lot of skepticism because people hadn't seen the virus that for themselves. They hadn't known many people who were sick. They hadn't known many people who were dying. So in that way, there was a lot of skepticism about the virus and whether it was actually real, and conspiracy theories kind of on the social media, like proliferating. Very few people were vaccinated, although that is now increasing. And things like hand sanitizer, masks, very difficult, very expensive. I mean, a lot of people, you can see Hanan, one of our peer researchers here, is wearing a homemade cloth mask. So that, you know, there's a market in that, and people very entrepreneurial. But to get tests, to get hand sanitizer, I mean, that was very expensive. But the biggest impact has been the increase in the cost of living. So cost of food, cost of transport has gone up massively, and that had an impact on our research, as I'll explain shortly. Indonesia, as I said, much higher levels of infection, sickness and mortality, very prolonged lockdown, particularly in Jakarta. People were shut in their houses for weeks on end. Health services completely overwhelmed, a lot of fear in the community because people knew people who were dying, and people in our research team, professors that they knew had died, family members had died or become very unwell. So you can imagine the impact on people in terms of their mental health. And we were doing research on mental health with people with mental health conditions. And people with SMI, severe mental illness, are research has shown that they have been more likely to be infected and more likely to die or to be severely ill. That I haven't sort of gone into the literature on that yet, but in part this may be to do with the condition itself, but also to do with comorbidity, and also to do with the impact of the side effects of medications, which are, as you may know if you work in this field, can be quite detrimental in terms of heart conditions and things. And then some of the research team were living with vulnerable family members and were concerned about passing on the infection to them. So what did this mean for the research process? Well, ironically, given that the burden of mental illness of COVID was much higher in Indonesia than in Ghana, we actually ended up overspending in Ghana and underspending in Indonesia. And the reason for that was that in Ghana, the costs of everything went up massively. So the cost of transport, the cost of food, all of that was just much more expensive. That meant that doing any workshops, catering for the workshops, traveling around the country, the costs of internal flights went up massively. So we spent quite a lot more than we had initially budgeted in Ghana because of this increase in costs. Meanwhile, in Indonesia, because the pandemic was so much more severe, we had to do most of the research online, and we did very few face-to-face activities. And so obviously that was cheaper because we didn't use any of the travel budget. We never went to Indonesia, we did go to Ghana. Our research timelines were really disrupted. I mean, there was a point in Indonesia we couldn't really do very much. Everything took longer. Someone was talking about getting ethics. That took, it wasn't the ethics that took ages, it was the transfer of funds from UK to the collaborating country institutions that took ages, because everything was kind of slowed down due to COVID and people off sick and stuff. So it really was quite challenging to meet the research timelines, and we've still been sort of dealing with the fallout from that to date. And of course, the fact of doing online interviews in Indonesia meant that we did only reach a certain sector of society, although I mean, compared to Ghana, there's a lot more kind of online activity, and more people have access to the internet, and the internet is more reliable, and we were able to do online training with the Indonesian team. That worked quite well. It worked less well for the Ghana research team. So these inequalities can kind of be reinforced in that way, as we've seen throughout the pandemic, but particularly in terms of internet access. And then there was the direct impact on the research team. So there was a lot of stress and anxiety around the pandemic, particularly in Indonesia, where, as I said, the impact was so much higher. And so this did impact on the research team, on their own well-being, both amongst those who had mental illness and those who didn't. And for those who had psychosocial disabilities, who had mental illness, it could in fact, have contributed to them becoming unwell, because some of them did experience a deterioration in their mental health. And of course, then we had to consider, ethically our position there, and whether we might have inadvertently led to people becoming unwell, even though we had put safeguarding and we had taken that into account in our planning. Still, we are sort of in our reflection process thinking about that and this sort of double whammy of severe mental illness and COVID. And of course, the uncertainty around research timelines and the budgets for people whose incomes were already quite precarious added an additional stress. And it was difficult for peer researchers in Indonesia to access mental health care and medication during the pandemic, as resources were shifted to COVID-19. So that was one of the major findings from Indonesia, was that a lot of the resources which had been for mental health were shifted to COVID, and mental health is already an under-resourced area of healthcare. And conducting research online was challenging, not just because there were connection difficulties, though this was significant, but it was, in our previous session, one of the researchers was saying that, it was very difficult to build rapport when you were doing research online, particularly when you were talking to people who have mental health issues, or you're talking about issues that are stigmatized, that are sensitive. It can be quite difficult online to conduct those kind of interviews, particularly with people you don't know very well. But then on the other hand, doing research face-to-face also provoked a lot of anxiety. In Ghana, it wasn't so bad. We were able to do a lot of stuff outside. As I said, the infection rates were lower, so there was less concern about that. So the implications really are that there is a need to build in additional time to support team members in these situations, and particularly when working with marginalized and vulnerable groups. And I think, that when thinking about doing research in conflict and doing research in pandemic times, a lot of these same issues come about. And this need for flexibility, which really doesn't fit in with the way that a lot of research is imagined when we're writing proposals, when funders are putting out their calls, this and ethics procedures. We don't always think about this need to build in flexibility to do research well, particularly when it's participatory, and particularly when we are in situations of conflict, situations of chronic poverty and stigmatized and marginalized conditions, and not just for timelines, but in access to resources. So in a way, it worked out well that we had some flexibility, and AHRC were very understanding in allowing us to kind of swap resources around and use the budget more flexibly. And we need to consider how to ensure the safeguarding and safety of our research teams. The online option is not always the best and can reinforce inequalities. So how can we do research face-to-face and protect people and make sure that they're not exposed to risk, but that we don't also exclude people that we want to reach in our research, and that balancing that can be quite difficult. I think there are more implications which I haven't had time to draw out now, but I hope that's sort of given you a bit of a flavour for some of the learning from our research. Please do watch out for upcoming outputs, and we've got some participatory videos we're hoping to be sharing soon. So thank you ever so much for listening, and I'll hand back to the facilitator. Thank you.
Thank you very much, Ursula. I think we have about 13 minutes for some questions.
but I think there was a question from someone called Bridget about,
Yeah, I think, yeah, I'm just having a look through. I can't,
yeah.
I've got too many screens open.
It
But yeah,
says-
we had a question following the initial presentation about how adapted methods resulting from COVID-19 might be used in future work in conflict or crises. So if anyone wants to speak on that, I think there was a bit of discussion in the chat, but if anyone would like to elaborate on that more.
I mean, maybe I could say something a little bit in terms of online. It's been really kind of I'm sure, like for many of you, it's been kind of interesting to see what being online as we are now enables and what it doesn't, because I've really, you know, in some ways it's enabled us to sort of, and Hannah Kienzler, who some of you will know here, that who works in Palestine, we've talked about this, you know, it sort of enabled us in some ways to sort of flatten some of the hierarchies between institutions in the global north and the global south, and that we're all online, so we're all on this online platform. But then you know, I work in Nigeria now as well, and in Ghana, and you know, there the internet is quite unstable a lot of the time, and so that always isn't great. And then some people, you know, are on camera and some are not. So in terms of you know, people were talking about lip reading and things like that, you know, this presents all sorts of different challenges. So yeah, it's something that we're thinking through, I think, how this has opened up some spaces which have been positive, but then also had some drawbacks. So I think someone else had put their hand up. So.
You want to have a go at presenting your final slide, maybe? I think that ties in what we've just discussed as well, about sort of some drawbacks, but also some positives coming out of adapting of how we do things. Can share the slide again. Susan, are you there?
Yeah. Can you hear me?
Yes, it's very echoey though.
Yes, we can hear you. Yes, we can hear you. Yes.
Good. Yeah, the internet connection was lost, so I wasn't sure if you hear the last slide or not. So, okay, continuing with the last slide about our lessons learned from conducting research in chronic political violence and now with the pandemic. So it teaches us to adjust, accommodate, and find creative ways of completing research despite all the hardships that we experience. So these ways, we also, they are not new ways. We resorted to during pandemic, but we had used them in the past. And also we had when there was escalated conflict. And once we taught our students in the Master of Community and Public Health, we taught them remotely in the period of 2000 and 2004. It is one of the examples when we used fax machine to teach our students. And yeah, this is always the case with a creative or a new method that we use. We win some and we lose some. And there was a question in the chat that will we use these methods in the future? We always develop innovative or creative methods to overcome the challenges we go through living in. As Palestinians, we live always in conflict and under chronic political conflict, violence. So we always accommodate and adjust new ways. Mm-hmm. So it's the pandemic and it wasn't weird for us to develop these methods because we are used to them. It's not that we invented the new methods, but we used the methods that we always use when there is escalated conflict or when we cannot go to the field.
Thank you very much, Susan.
Thank you.
We've got a question in the chat for Ursula on why did you choose Ghana and Indonesia, and is it a fully comparative study?
Thanks, Vera. I was just typing an answer in the chat.
Sorry.
So I could just read what I was saying. Yeah, we already have a project with Indonesia and Ghana looking at how mental health workers and healers, traditional and faith healers, are working together in those two countries. So which was based on a kind of recognition of similar human rights concerns around people with mental illness, particularly the use of forms of restraint. And there's been a lot of attention to in both of these countries on that issue, and both Ghana and Indonesia have implemented efforts to try and address that. And so we already had this research which was in progress, and so we wanted to build this project onto that. And it's interesting that Indonesia has like this UNPRPD project, but Ghana had not done that. But there was a lot of work. There's a lot of work being done by NGOs and the government around the CRPD and integrating mental health into the disability rights work, and to take that kind of disability rights approach to mental health. So there's been some great work done by some NGOs there and advocacy organizations. So we wanted to kind of build onto that.
Thank you. Do we have any more questions for either of the presentations?
Thank you, Vera, for organizing this workshop. Thank you.
Thank you very much, and thank you for speaking about some of the difficulties you face on a daily basis. And unfortunately, our partners from Ukraine weren't able to join us, but they were supposed to be presenting in the session originally about some of the difficulties they faced with working with internally displaced people.
I see.
Just give anyone, if anyone has any, thinking of any questions, I could just give a few minutes. I think if we have no more questions, we can wrap up a little bit early, and I hope everyone will be able to join us in the final session, which is our keynote speaker, Dr. Ola Abu Al-Ghaib from the UNPRPD, which will be really exciting. We're really honored to have her join us. So I hope you're all able to join us in at 4:30 UK time, back in the original Zoom room. And the link is in the chat. Thank you very much, everyone.
Thank you, Vera.
Thank you.
Thank you. Thank you all.
Thank you.